Module Overview. This module focuses on the core standard precautions and the effective use of personal protective equipment, PPE, in healthcare settings. As foundational IPC strategies, these protocols are designed to minimize exposure to blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes, regardless of patient diagnosis. In light of the COVID-19 pandemic, the relevance and complexity of PPE usage have escalated. This module not only examines traditional PPE practices, but also explores new standards, emerging technologies, and policy reforms that have evolved to protect healthcare workers and patients from high-consequence pathogens. The module provides a layered understanding of PPE types, donning and doffing techniques, evidence-based usage protocols, risk-based selection of PPE challenges during pandemics, shortages, training, burnout, legal, ethical, and cultural dimensions of PPE usage. 1. The concept of standard precautions. Definition: standard precautions are the minimum infection prevention practices applied to the care of all patients, regardless of suspected or confirmed infection status. Core components: hand hygiene, soap and water or alcohol-based hand rub. Use of PPE based on anticipated exposure. Respiratory hygiene, cough etiquette. Safe injection practices. Safe handling of potentially contaminated equipment/surfaces. Environmental cleaning and linen management. Sharps, safety engineering controls and containers. 2. Personal protective equipment, PPE. Types of PPE. 1. PPE. Item 2. Purpose gloves. Protect hands from contamination. Gowns, aprons, protect skin and clothing from body fluids. Surgical masks, barrier against large droplets, N95/FFP2 masks. Protection against airborne pathogens. Face shields protect eyes, nose, mouth from splashes. Goggles, eye protection, head covers, hair protection in sterile environments, shoe covers, floor and shoe contamination control, surgical areas. Donning and doffing procedures. Must follow institutional and WHO protocols. Donning, gown, mask, chutch, respirator. Goggles, face shield. Gloves. Doffing, gloves, goggles, face shield, gown, mask, hand hygiene. Errors in donning and doffing can lead to self-contamination and are a major cause of healthcare worker infection during pandemics. 3. Risk assessment and appropriate PPE selection. Healthcare workers must assess risk based on type of patient interaction, anticipated exposure to fluids or droplets, aerosol-generating procedures, AGPS, patient diagnosis and cohorting status examples. Blood draw from healthy patient, gloves only, treating COVID-19 patient on ventilator, N95, gown, gloves, eye protection, surgical procedure, sterile gloves, gown, surgical mask, face shield. Part 4. PPE challenges and adaptations during and after COVID-19. A. Global challenges. Experienced massive global PPE shortages, 2020 to 2021. Black market products and fake certifications. Burnout from prolonged PPE use, especially N95s. Difficulty in communication and patient rapport. Cultural resistance in low-resource settings. B. Post-COVID adaptations. Reusable PPE with sterilization protocols. Fit testing mandates for respirators. Digital PPE tracking and inventory systems. Telemedicine to reduce unnecessary contact. Use of AI for PPE optimization. International trade policies to protect PPE supply chains. Mental health and ergonomic support for workers in extended PPE use. PPE. 5. Legal, ethical, and accreditation frameworks. Legal and ethical duties. Provision of adequate PPE is a legal responsibility of employers under occupational health laws. Healthcare workers have an ethical obligation to wear PPE appropriately to protect others. Institutions must ensure training, fit testing, and supply reliability. Accreditation and guidelines. WHOP. PE Guidelines, 2020, 2022. CDC Isolation and PPE Guidance, UKNH-SPPE. Strategy Framework, Canadian Centre for Occupational Health and Safety, CCOHS Protocols. OSHA, Regulations on Respiratory Protection, Learning Outcomes, Module 3. By the end of this module, you will be able to define standard precautions and explain their components, identify and describe types of PPE and their functions, demonstrate correct donning and doffing procedures, conduct risk assessments to select appropriate PPE for various clinical scenarios, analyze post-COVID changes in PPE usage, policy, and ethical considerations, accreditation and compliance notes. This module is structured according to global healthcare and infection prevention education standards, WHO, core components of IPCCD CPPE, and standard precautions protocols, NHS and public health, England PPE updates, Accreditation Canada IPC education standards, ISO 16604 and ISO 22609 for PPE certification. It is compliant with CPD requirements, suitable for professional development certification, and can be integrated into healthcare worker orientation and clinical safety training programs.